were dispatched to the scene of a rear-ended car crash. You see an 80-year-old female laying on the ground in front of her car, and she is complaining of right lower leg pain.
Alright, PP is my scene save.
Yes.
Alrighty, so is this my only patient?
Yes.
Alright, so I'm going to call for additional EMS assistance, and I'm going to ask someone to hold C-spine. We don't have another person to hold C-spine, so just use your imagination. My general impression, or the mechanism of injury, is that there was a car crash and she is now laying on the floor in a supine position, which is my general impression, is that she's laying on the floor, supine position, complaining of lower leg pain. And the apparent life threat is her leg, most likely. So I'm going to move on to take my ABCs. So I'm going to start with airway. So if I can have you open your mouth for me. Her airway is clear. And then I'm going to check breathing. So I'm going to listen to breathing sounds. Sounds good.
Yes.
Alright, and then I'm going to watch her chest rise and fall, make sure she is breathing, which we have established in the previous step. Then I'm going to check circulation. So you have what is her pulse rate?
76.
Alright, so we have the pulse rate. What is the consistency of the pulse rate? Is it like weak or?
It's steady, rate, and good.
Okay, so I'm going to mark this as a priority patient, and then after that I'm going to take a set of vitals. So I take my set of vitals. What are her vitals?
She's breathing at a rate of 14, 76 pulse rate, lung sounds are clear, and her blood pressure is 138/65.
Okay, so relatively normal vitals. So then I'm going to acquire my sample history. So, ma'am, I'm going to ask you some quick questions. So, are you feeling any pain? You were complaining of pain in your lower leg?
Yeah, my leg hurts, my right leg.
Okay, so what kind of pain is it? Like a stabbing or?
It's like a throbbing.
Okay. So, what I'm going to do now is do you have any allergies?
No.
Are you taking any medications?
No.
Alright. Do you have any, I'm assuming you have no history of leg, do you have any history of like any injuries to your leg or?
No.
Alright. And then what did you eat last?
I had a sandwich.
Okay. So, and I'm assuming once you got the car crash, your leg started hurting?
Yeah.
Alright. So, after that, I'm going to begin my secondary assessment, my head to toe. So, I'm going to check her skull, see if there's any deformities, jawline, all that. I'm going to move down to her neck, check the jugular, size of the neck. Are there any deformities in the head or the neck?
No.
Alright. So then after that, I'm going to put on the C collar, size it appropriately, and then I'm going to place this under neck. There's no way. Place this on her neck. Alright, and then I'm going to continue with my secondary assessment. So I'm going to check the shoulders and the clavicle bones, and move down, check the sternum. Alright, is there any deformities?
No.
Alright, then I'm going to palpate the ribs. No deformities in the ribs?
No.
Alright, now I'm going to check the 4 quadrants. So I'm going to check all 4 quadrants. Is there any deformities there?
No.
Alright, I will assess the genitalia, and then I'm going to assess the legs, ensure that there are no deformities.
Ow.
Alright, so there appears to be a response to pain in her right leg. So I'm going to go down her other leg. Alright, and is there any deformities in her right leg?
Yeah.
There is. Okay. So now I'm going to move on to checking her arms. Okay. And now I'm also going to check CMS. So if I can have you squeeze with my fingers. I'm going to take a pulse. She has a pulse. Can you feel that?
Mhm.
Alright. She has a pulse. Excuse my fingers. Can you feel that? Alright, now I'm going to check her footiness. So is it okay if I take your shoes off?
Yep.
Alright. So let's take her shoes off. A little tight. Alright, so I'm going to check CMS in her feet. So, which toe am I squeezing?
The big one.
Alright, she has pulses in her feet. Do you feel that?
Yep.
Alright, so what I'm going to do now is I'm going to splint her leg. So, something. I'm going to size this to her lower leg. Alright. So, it's watching the master work. Master work, that's what you can call it. Alright. Then I'm going to tie this around her leg. Alright. After we split that, we're going to place her on the spine board. So I'm going to ask her to try not to move her onto the splinted leg, preferably. So we're going to move her on head count. So 1, 2, 3, and then place her onto the spine board. And while that's happening, I'm going to assess the lower back for any deformities. Are there any deformities in the lower back?
No.
All right, so then we're going to move her back onto the spine board at the heads count. 1, 2, 3. And then we are going to adjust her on the spine board. So on heads count, we're going to move her diagonally up. So 1, 2, 3. All right. Now I'm going to secure her to the spine board and then recheck CMS in all extremities. So, can you squeeze my finger? You feel that?
Yep.
And she does have a pulse. So, which toe am I grabbing?
The big one.
All right, can you feel that?
Yep.
And she does have a pulse. And then I'm going to transport her.
The ALS, the life.
The ALS
Has arrived.
will arrive, and then I'm going to give my field report. I'm going to say this is a 80-year-old female who got into a rear-end car crash and I found her laying in a supine position when I arrived. So I took my airway, breathing, circulation. She has relatively normal vitals, and then I did perform a secondary assessment. She had pain and a deformity in her right leg, so I splinted that and placed her on the spine board and secured it to her. And that should be it.